3, 2, 1.
Hi, my name is Cris Alonso, and I'm a doctoral student. And I've been working with the government of Chelsea and the Colaborativa to understand the results of the positive cases of COVID in Chelsea from March to August of this year. We looked at 3,302 cases between March 9th and August 3rd to have a better understanding of how COVID has impacted our health and how COVID has impacted our lives. What we found was that we had a peak in cases in March. This was followed by a peak of hospitalizations, which was then followed by a peak in deaths. So if we look at future trends, we're going to see that first, people are going to start getting COVID. A couple of weeks later, people will start being hospitalized. And a couple of weeks later, people will start sadly dying of COVID. Who gets COVID? So what we found in Chelsea is that the average age of people getting COVID is around 44. And we actually found that men and women get COVID at around the same age. So what we're seeing is that people in their early 40s are most likely to be getting COVID. We also found that the older you are, the worse things go for you when you do get COVID. So for example, if you look at the first graph, you can see that people in their early 40s were more likely to get COVID, but were not more likely to be hospitalized. People that are more likely to be hospitalized are older, starting in their 60s. However, for people in their 80s, they're sadly much more likely to die. So we see that people who recovered from COVID after being hospitalized tend to be younger, and people who we don't know if they died or if they survived, they tend to be in their 60s. What races get more COVID? We've seen nationally that COVID is disproportionately impacting Black and Brown communities, and this is true in Chelsea as well. Most people who are getting COVID are Hispanic, almost 60%. We're finding that the labs have a very fast turnaround time, but what's most important about this information is that we're finding that people are taking 1 week between their symptoms to getting a test. So this is the first thing we want you to do. Don't wait a week between when you start getting your symptoms until you get a test. You need to get tested fast, and you need to get tested frequently. The other important finding is that almost 35% of people had no symptoms. I'm going to say this again. 1 out of every 3 people who have COVID don't have symptoms. So if you're waiting for your symptoms and then waiting a week to go get COVID, during that time, you might have infected a lot of people. So here's what we want you to do. Don't expect to get symptoms, and don't wait a week if you do have them. Remember this, 1/3 of people who have COVID don't have symptoms of COVID. The other thing that's important is that we found that across the board, Hispanics, whites, older people, younger people have the same amount of loss of taste and smell and other symptoms that are typical of COVID. However, we did find that retired people are less likely to have chills, headache, and body ache. They're less likely to have a sore throat, and they're less likely to have a fever. This is important because we often think of fever as one of the most important symptoms. So keep this in mind when you're taking care of seniors, that they might not have the classical symptoms of COVID that we're expecting. This is the same for children. Children will have less body aches, less chills, and less headaches. Diabetics will also have less headaches. The other thing that we found is that there are certain groups that will have more symptoms. So for example, those who identify as other in race, which tends to be Hispanics, have almost 5 times the amount of shortness of breath. Asthmatics as well have almost 6 times shortness of breath. This is important because shortness of breath is a very scary experience. We found that most people who are hospitalized from COVID are in the hospital for about a week. Most people recover, and about almost 10% die of COVID. We found that seniors are disproportionately impacted by COVID. So most people who get COVID, almost 35%, are retired. We also found that essential workers represent about 20% of the COVID cases in Chelsea. We also found that unemployed people, even though they're at home, they're still getting COVID. However, when we look at who's hospitalized, we found that unemployed people get hospitalized more than employed people. This is important because we want to make sure that everybody has access to health care and everybody goes and gets care from a primary care physician or from the hospital whenever they need it. Don't wait until your symptoms are very bad. It's really important to get care as soon as you get symptoms. And like we said before, remember that 1/3 of people who have COVID don't have symptoms. So remember to get tested. Who's more likely to be hospitalized with COVID? Well, it turns out that women are less likely than men to be hospitalized. However, pregnant women are much more likely to be hospitalized. So if you're pregnant, make sure that you don't get exposed to COVID. And if you have a pregnant woman in your family, make sure you take care of her so she doesn't get COVID. Seniors and unemployed people are also much more likely to be hospitalized. There are certain diseases that we know impact your probability of dying if you get COVID. So for example, if you have cardiac disease or chronic pulmonary disease, you're over 100 times more likely to die of COVID than people who don't have these diseases. If you have hypertension or diabetes, you're also much more likely to die. So if somebody in your family has cardiac disease, chronic pulmonary disease, hypertension or diabetes, take care of them. Take care of yourself if you have these diseases. Like we've said before, sadly, many of our seniors are dying of COVID. We need to take care of them. So in conclusion, what's important for you to know as a resident of Chelsea? It's important that you know that most people who get COVID are Hispanic essential workers and retired people. We also know that older people are much more likely to be hospitalized and to die of COVID. We know that people are taking about a week between the start of their symptoms before they're getting tested. This is scary because during that week, they could be infecting other people. Don't wait until you have symptoms of COVID to get tested. Get tested regularly because now we know that over 35% of people in Chelsea don't have symptoms when they have COVID. We know that those who have cardiac and pulmonary diseases, hypertension and diabetes are much more likely to die of COVID. So let's take care of people who have these diseases and let's protect them from COVID. Let's also take care of pregnant women. It's important that they not be exposed to COVID because they're much more likely to be hospitalized. And finally, those with asthma, those who are unemployed, and seniors are also much more likely to be hospitalized. So remember, wash your hands, wear a mask, and avoid social gatherings. Thank you so much.